You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, CoolSculpting. We're talking about freezing fat today. It's the newest, hottest cosmetic procedure, and in many cases, and the experts believe, this is the replacement for liposuction with great results. With us, we have an expert on the topic, Dr. Edward Tangchitnob. Dr. Tangchitnob, welcome to the program.
Thank you, Randy. I'm just so excited to be here today to be sharing what my thoughts are on CoolSculpting.
Okay, good. Now, you brought a lot of photos, so we'll show this. Now, we should say, you help women, right? You're a fellowship trained in gynecologic and robotic surgery, and you have a large practice in West Covina, you and your father. For people that don't know you, and we'll go back to CoolSculpting, who's the typical patient? Like, what are the different services you offer?
Well, it's really interesting because, as you said, I take care of women. And, I actually joined my father about 6 years ago, and we have a very busy OB/GYN practice, and we take care of women from the very, very young through menopause and beyond. In our practice, we are a full-service practice. We offer bioidentical hormone replacement, we do aesthetics, and recently we've really gone into body sculpting because really that is the full function, full offering women health practice.
So this is, we said at the top of the show, I mean, this is becoming one of the most popular procedures in cosmetic surgery. So it works? I mean, the results are good?
Absolutely.
I mean, you had it done, right?
I have. In fact, I've actually had 6 cycles done. And, just take a look at this picture,
sure,
for example.
Okay.
This is actually me, and, we have really pride ourselves in body sculpting. And what does body sculpting really mean, Randy? Body sculpting comes on a variety of different ways, right? You could do liposuction. We all know liposuction. We could have surgery. You could have minimally invasive procedures. You could have non-surgical. But what we're talking about here is CoolSculpting, which is a non-invasive, non-surgical way to do body sculpting. Now, in that picture there, I was particularly bothered. I was in the gym. I was trying everything I could.
Looks like you're poking at your stomach on purpose on this.
Actually, that's not even me poking at my stomach. That was really good before.
Okay.
And with 6 cycles, you could actually see that I performed it on the lower abdomen.
That's very nice.
Thank you.
You can see your muscles are coming through on this.
Yeah, I think so. I think it's a result that I'm particularly very proud of. But I've also had some help. I say it was almost a cheat or a hack. And CoolSculpting is this amazing technology that has really come onto the scene and has enabled patients or potential people who otherwise would not have had lipo or any of the non-invasive procedures and get some body contouring done.
So that fat is dead. That means the fat that's targeted, it dies. Those
permanent.
fat cells don't come back.
It is permanent.
Is that true?
Absolutely. So it is permanent. So about 20–25% at a time actually die. And it depends, right? Every patient is different with response to or with regard to how they respond to the treatment. But we say 20–25% at a time.
Now, we were talking also, I have to bring this up. I love what you said. You said that liposuction, and I'm paraphrasing, but that liposuction may go away in the future.
I think it may. And I think there might be a set of the population that still does liposuction. In fact, we still perform liposuction in our own practice. We're a full service women's health practice. But that being said, think about the patient who wants liposuction. They want immediate results. They want then and there, and they want it pretty much right away. But they also have to take into account the fact that there might be some downtime. Even with the minimally invasive techniques we have with liposuction now, one that comes to mind is the use of tumescent solution. Do you know what tumescent solution is?
A little bit.
Yeah, so tumescent solution has really changed the way we perform liposuction. We could apply a local anesthetic, the patient is awake, and you could pull out the fat while the patient is actually awake. And it's going to change because now, instead of even doing that, this is an even less invasive approach because no cannulas, nothing goes underneath, there's no surgical instruments that actually go in to pull, and there's no anesthesia. The cold is the anesthesia.
And it works.
And it works.
I've talked to plastic surgeons about this that do liposuction, tummy tucks, and this.
Sure.
And they said the problem with lipo on the younger patient is you can get lumps and bumps. It's very common lumps and bumps, whereas with CoolSculpting you don't. That's why he says, I'm a convert. I'm doing now.
And I think that's a great point, Randy. I think that there will be patients who are the liposuction patients, and then there are patients who may be the CoolSculpting patients. Now, to get back to your original question, who, right, of the aesthetically minded groups, and there's a lot of aesthetically minded patients out there, wouldn't want to take an inch off, right? But then when you follow up as a corollary to that, whether they would want downtime or undergo a surgical procedure, most of these people would say no. And so CoolSculpting, this new technology, has come out and really has enabled patients who are aesthetically minded to enable to be able to get the body contouring solutions that they want.
Now you say the CoolSculpting of just 2 or 3 years ago, even a year ago, is dramatically different than today.
Well,
How
it
so?
is because we're getting better results now.
Okay.
And a lot of it has to do with the new hand pieces that have actually been developed for the new CoolSculpting machines. So even those patients who've had CoolSculpting, say, 5-6 years ago, they're having a different experience now because the new hand pieces are just simply giving better results.
So back to your photo again.
Sure.
You say you're not done yet.
Well, I'm not.
I mean, what else can you do to that?
Well, listen, I think each one of us has something that we are bothered with.
Okay.
And to that point, I mean, nowadays, if something on your arm bothers you, or there's some part of your chin that you always lived with, and it bothers you, well, guess what? You could do something about it. For me, it was particular areas of the love
But this right
handles.
here, on this after, where do you want to go from here?
Oh, I want to go on the sides. I want to really bring in that lower abdomen. I mean, we talk about the V shape for men, and I think it's very conducive that, if that's this area that happens to bother me, I mean, I'm sure it bothers other men too. Classically, we describe it as the love handles, and it comes in different kind of shapes, sizes. Particularly after the age of 40, I'm finding more and more men, even as a board-certified GYN surgeon, coming into my practice. And it's usually the husbands that come, but some of the husbands have actually brought their friends now.
So the women, I've heard that if you're over 40, there was a Gallup poll, we talked about this, that everyone over 40 has considered or thought about liposuction. But most of them talk themselves out of it because of the surgery.
Absolutely, and when you kind of look at a typical room of patients and you start asking people whether or not they would want an inch off their waist or not, you'd be very hard pressed to find people who would say no, especially over the age of 40. Because a lot of things have happened over the age of 40, Randy. Our hormones change, we are working more than ever as a society, and we're exercising less. We're not eating as clean as we used to. I think there's a lot of things that really are going on that are very real, that go beyond just traditional medicine.
Okay, so let's talk about where you could remove fat.
Sure.
With this, and maybe we'll start from the top down.
Yeah.
So what are you doing?
So it's so interesting. There's so much information out there, and many of our patients find information from a variety of sources. And we think of variety, we think about Google.
Yeah.
And so the way I approach my consultation, I tell my patients, is we have a very total transformative head-to-down approach. So I call this the sushi menu. Let me actually show you.
This is the sushi menu.
Yeah, this is a sushi menu. We kind of we kind of joke about it in our office, and we call it the sushi menu because a lot of times, most of the patients, if they've heard of any kind of CoolSculpting, will say, "Can you treat my abdomen flanks?" But did you also know, and I give them the menu to take a look at, you could treat the chin, you could treat parts of the upper arm, you could treat the back fat, the parts of the fat that actually come over the bra, right? The bra fat, or the axillary puff is what we actually call it as well. You could also treat kind of going down head to toe. You could also treat the lower abdomen. You could treat the love handles, the lower abdomen as well as the flanks and the legs. Inner thighs, another area we could treat, as well as the back.
Okay, let's talk about neck. Let's start there with I'm calling it a neck, but the chin area, that little double chin. How well does it do there?
It treats it very well. So a lot of times when we look at someone's face, it's so interesting. We wouldn't really think that looking at someone's chin or improving the chin gives a more youthful shape, but you'd be surprised by taking away or making that pocket of fat, the submental fat, actually go away. It gives for a more youthful appearing shape. So I think it's really great because a patient that actually comes to mind, Randy, it's so interesting you bring that, is a patient of mine. She's one of my hormone patients. We've done bioidenticals on her. She's lost more than 30, almost 35 pounds now. And I remember very specifically she came to me, and in one of the consultations in fall, because I follow my patients so closely, she stopped losing weight. And I was like, what's going on? You've been doing so great. You're doing all the things. Your labs look good. Why did you stop losing weight? And she told me is because she started noticing changes on her face. And that's why she stopped losing weight. And I basically then kind of shifted gears towards doing a facial consultation. And I found out that because the way her shape was changing, she didn't want to lose any more weight. She was noticing things that she didn't notice before. She was losing volume in the face, and there's a prominent kind of neck area. She called it the goose neck. And so we did CoolSculpting on her chin, and she's happier than ever. She's had good results, and she's continuing along her wellness journey. That's what I call it. It's the wellness journey.
So the chin area, popular. That double chin.
Very popular. And I'll tell you the enabled technology, social media. So a lot of patients will actually really not notice until they see a picture of that side profile and they're like, oh, that's my neck.
Your side view.
The side view, and that's the one. And it's the one that gets blasted all over social media, and they see it because they're going back in the pictures, they're going to their Facebook or their Instagram, and they're like, is that really what my neck looks like? But now we actually have a technology. We have a CoolSculpting handpiece that enables the destruction of the submental fat or the chin area. It really gives that clean look. You look rested. It gives that very youthful shape to the face again, and all just from a CoolSculpting treatment.
So at what age does somebody get CoolSculpting of the chin, in your opinion?
I would say you could start as young as the early 30s, which is generally the time when collagen begins to change, the kind of structure of the skin begins to give way to fat that accumulates in that area. So I would say as early as the early 30s.
Let's take a look at this photo. So
Sure.
this before and after, this woman, that's like a typical result?
It's a typical result. And again, every patient is different, but when you look at it, even without the untrained medical eye, someone could take a look at that picture and say, that looks better. And without kind of giving away what has happened or that we've done CoolSculpting on this individual, I think most people agree when you look at that picture, it just looks better. There's a better shape to her, a much cleaner profile. And I'll tell you, this patient, if she takes a selfie or she takes some kind of side profile picture, she'll be happy.
Now, is this, and you do a lot of procedures for women, making people look better in their 40s and 50s and feel better and things like that. Is this one of the happiest group of patients? When it's all done?
This is a very happy group of patients. Listen, Randy, I mean, we do so much in medicine, and a lot of times we feel like we're always chasing. We're chasing an acute event, such as a heart attack, or we're chasing a bad outcome, and we're chasing, and now we are able to actually catch aesthetic kind of needs along the way in a way that we haven't been able to before, because now we have a non-invasive, non-surgical, very minimally invasive downtime procedure that's available to our patients.
So the and the newer heads, the things that actually freeze the fat, those have changed.
They have
Like
changed.
it's only like a year old?
Yeah, so about 2 years old now. So their new heads have actually come out, and there's less downtime. It actually takes less per session, so we're actually able to treat more different areas per session, and also there's less pain.
Now, I was told, maybe it was a couple of years ago, that you couldn't do the neck, the chin area.
Well, before
So that's changed?
That's changed. Now we are able to do the chin.
The chin, so hot area. So really anywhere, even though it's indicated for what we're talking about, but anywhere where you have unwanted fat and could pinch it, you can get rid of it with CoolSculpting.
Well, in our office, we say if we pinch it, we could freeze it.
Like even the back of the neck, even though you're not supposed to do that
Technically,
area.
you're not supposed to, because it's not. There's not an indication for that. But if you think about it, if doctors, all we did was we're doing things on label with the FDA, right? Then we wouldn't have any kind of progress or indication. I think that conversation is really between you and the physician, right?
Okay.
Because it's tailored, it's custom, and it's different from person to person.
Okay, moving to the arms. How well does it do on the arms?
Arms are great. We've had great results with the arms so far. And you think about the typical patient that walks in my practice, if they're particularly bothered by their arms, it's usually because they have an event coming up. And so almost always when I do my consultation, I stop, I ask my patient, do you have a wedding or some kind of event that's coming in the spring, maybe a benefit that you want to go to? Is there a dress that you have that you've been wanting to wear but your arms bother you? Maybe genetically, you've been born with arms.
Are a lot of women bothered by their arms?
A lot of
they
women,
tell
Randy.
you?
So many, an unbelievable amount. And I think the being bothered by it is one thing. Now, the other part is the willingness to offer that information, knowing that there's a solution for it, is something completely different.
So there are lean women that just have fatty arms.
Yeah, and these are the genetic women. They say they have their mom's arms, right? They call it the bingo arms or the bat wing, right? And we talk about it, and no matter what they do, no matter how much they diet and exercise, a lot of women will go around it by wearing things that cover them up, even though they want to wear a dress that shows their arms. And we actually have a solution for that now.
So that area, the tricep, like the side or the back of the arm, what are you hitting?
So we're actually hitting underneath the arm, and it's we call that area, we call the upper arm. So a patient comes in, we start doing the consultation, she will see the sushi menu, she checks that off. That's a whole conversation. And patients, when they come to my center for treatment, when they start getting treated, they sit down, they're relaxing, they're watching Netflix. If you want something to eat, we'll get you water, something to eat as
Does
you
it
kind of
hurt?
relax.
I mean, so they're sitting in a chair.
They're sitting in a chair.
And the applicator.
You'll feel a light sensation as you put a gel pad in between you and the applicator. so you don't get frostbite, right? But other than that, there's a little bit of a cold sensation, pulling sensation, and patients are off doing their emails and checking their social media, they're watching Netflix, and the procedure's over in 35 minutes. But when it's all done, the patients are just so happy, and they're looking at their arms, and even more than their arms, because they really are the greater than the sum of their parts. That inner smile comes out again.
Okay.
There's a dress that they're reaching that they've had in the back of their closet for so long now, or that dress that they walked past the mall and they say, I really want to try that on, but just my arms bother me. And I think when they look good, they feel good, and that really resonates with them. And at least in our practice and in our ethos, I really believe that it enables patients to make better health choices.
Now, what about the heavier patient, somebody that's larger, bigger arms?
So we've treated heavier patients, but if you think about the heavy patient, what does that mean, Randy? It just means they have more fat to destroy. And the applicators, you could do it. And each time you do it, it's destruction of 20 to 25% of the fat. So you could actually repeat the CoolSculpting procedure.
So are there any health benefits to this as you see it?
There's so many health benefits to this, because if we were to be here in 2019 and talk about how aesthetics is for the vanity, I think we really missed the mark on that one. I think aesthetic and cosmetic medicine is really about getting you to look good so that you feel good. And on that note, as you feel good, you are more opted to make better decisions about your life. We think about all the different procedures that we're doing now, and all the practices are now integrating aesthetics and cosmetics in their practice. Really understand that. So when you ask about whether this is healthy for you, I would say absolutely. I think it's very important that you look good and you actually feel good. And so you're more opted to eat better, you're more opted to exercise.
Do they?
And they do. I have patients
like they've invested in themselves, so now they're going to start
invest in
watching
this
their diet.
in this procedure, and almost as an outgoing, and I do this for my hormone patients as well, but I ask them what gym they belong to. And they almost do a double take with me. It's like, why is Dr. Tangchitnob asking what gym I belong to? And I just think it's so important, because it's so critical that we remove all the different obstacles to them getting healthy.
Is CoolSculpting the new aging gracefully? In a way?
I think it is. I think it is a big part of aging gracefully.
Because there's really no downtime.
There's no downtime.
I mean, you go to work that afternoon.
There's no downtime. You could go to work that afternoon, you go back and spend time with your kids, you could go work out, same afternoon.
The old days, it was about an hour. With the new heads or the new things that grab onto the fat, it's only like 30 minutes?
35 minutes.
35 minutes.
35 minutes. 35 minutes.
And they're done. So they literally can do this at lunch almost.
Right, exactly. And we always talk about that, right? It's the lunchtime neck lift and lunchtime this and lunchtime that. But is it really a lunchtime? Well, maybe if you had a 3-hour lunch, possibly.
And your team, your staff, they're all doing CoolSculpting.
Whole staff. We say everyone's
So they all
in.
talked you into getting it?
I think they didn't have any resistance when I did.
The doctors I know that do this, the plastic surgeons, dermatologists,
Sure.
They all start off skeptical, kind of like what you told me how you were. And then they're doing it to themselves and do it to their family. I mean, it's like the new hot thing.
It really,
do you think this will take over
is.
lipo? I asked you earlier, but do you think this is the new liposuction?
I think
or more effective, possibly?
I think this is potentially the new liposuction, and here's why, right? Because we just talked about in the beginning of the show that there are those patients who want to do something and engage in body contouring, but they don't want the downtime and they don't want the invasiveness of liposuction. Now, that being said, patients still really want to have body contouring. And so technology such as this, which is truly minimally invasive, has enabled patients now to actually procure the body contouring solutions that they want.
So dieting shrinks fat cells, and this removes the fat cells.
Well, actually, to be very clear,
how does that work?
The body naturally eliminates the fat cells. Because here's how this works. So after adolescence, did you know, you don't actually grow any more new fat cells. And so over time, what ends up happening is as you eat, and if you eat poorly, the fat cells that you do have actually get bigger, they hypertrophy. But the way that this technology works is just so amazing. It causes a controlled destruction of the fat cells that exist. So what does that mean? So when you get to a certain temperature of cold, there's years of research that have actually gone into this. It basically causes the fat cells to undergo programmed cell death. Now, if you want to take a look at any medical book, we call that apoptosis. But for the patients who are listening...
That's cell death?
That's cell death. That's the technical word for cell death. But what that means for our patients is that over the course of weeks to months, the body's natural mechanisms actually end up eliminating the fat permanently from the body.
Now, abs. You say #1 procedure. What are we looking at? You have some photos.
Number one area. Actually, here's a great picture of a patient, typical patient who comes in, and when you kind of talk about their treatment goals, this patient, you could see here, she's probably had 1 or 2 kids. You know, she decided that that lower area really bothers her in the abdomen. Now, when I kind of talk with my patients, I talk to them about the total transformation package, what could actually be possible, and we also give patients education on the fact that it can be repeated. So the patient, after you could see, after the first 8 weeks, was already very happy with the results. You could see that the patients had a decrease in lower abdominal fat, and I think that she was so happy she decided to actually go another round. And it really depends.
So 9 weeks, that's what it looks like.
After another round, yeah, because it could be repeated. Because remember, at the very beginning of the show, we talked about decreasing the fat 20 to 25% at a time. And that after looks great in the picture. But where it really shines, Randy, is when the clothes come on and that abdomen is flat and it's just so flattering and the patient feels good. We think about that little black dress, the cocktail dress that the patients love, right? And I think it's just so rewarding for the patients as they feel good about themselves again. And when you're that 35, 40-year-old woman and you have a flat stomach and you're just owning the room, that's attractive. That's sexy.
That's true.
And
self-confidence
really
is sexy.
Oh, it's
so when people feel good.
Absolutely. It is very attractive and sexy. And you know what? I think, Randy, it really is begetting because that patient now might not reach for that bad food, might actually put out that extra hour at the end of the day to go to the gym because she wants to maintain that. And I think I call it a quick win. That's
Okay.
what we're a society of quick wins now, and why not in healthcare?
So you can go all around the abs, that whole, they call it a muffin top.
Absolutely.
You can hit that, eliminate it,
You
kill
can
those
definitely
fat
do that.
cells,
Exactly.
it's gone.
Absolutely. Yeah.
And no downtime.
No downtime. No downtime. You could go back to life the same day. And what does life mean? You could go back to work. You go back to playing with your kids. You could go work out the same day. No binders, no downtime.
Now, another area on the back, the bra
Yes.
fat. Is that really a problem?
Huge problem. I mean, I have
People hate that?
We have a very busy women's health practice, and we have women coming in all the time. And it's very interesting because most of my girls who have actually at this point all have had CoolSculpting at this point, when they bring the patient back and they're taking their vitals and they're doing, I call it the girl talk, and they're talking between each other. And a lot of times when they're looking at the sushi menu, they will offer this information. Say, you know, that bra roll that puffs out when I put on my bra, it really bothers me. And when clothes go on, the clothes don't look right, the dresses don't fit right. Does Dr. Tangchitnob have something that I could actually do about it? And in the consultation, we talk about ways we can.
Because you have to do some serious dieting to try to hit that back fat.
But that's if that even happens. Because what you see, Randy, is pockets of fat are not always responsive to diet and exercise. The fat might not be perfused well enough that you could actually get rid of those hard to get rid of areas.
So genetically, just some women have more fat cells on their back than others.
Exactly, you got it. So genetically, some patients are more predisposed to having fat pockets in unattractive areas that they deem are unattractive. And even more to that point, no matter what diet and exercise you do, you might not always be able to get rid of that back fat. But when it's all said and done, it's all about the clothing. They're wearing backless dresses again. They're wearing revealing dresses that show that area that they once actually wore other kinds of clothing. We think about frumpy sweaters or things that they're wearing to actually hide that area.
Do they tell you that on the consult? Like, oh my goodness, I wear clothes to hide my back fat.
Absolutely. You know, I think that the women really have a way to hide those things. They do it through clothing. But to that same token, if they feel proud and they feel very attractive, they're more apt to own the room.
Okay, legs, and we're short on time. How well does this treat for legs, and what part of the lower body are you treating?
Legs are great. So when we think about legs, we think about the outer thigh, which is also a very popular area to treat, and the inner thigh. We call the thigh gap. So a lot of patients who come see me, either through time or they have the saddlebags that they've actually inherited from their mom, really bother them. It could be that the rest of their body is a certain ideal shape for them, and they like the way they look, but that outer area, the thighs, really, really bother them, or even the inner thighs, and we could treat that.
So the inner thigh, outer thigh machine, we discussed this on the phone, you say may not get rid of fat
It may
in
not.
that area.
And you think about all the devices and equipment that you see in the gym, you see the women squeezing away, and that's great. It's great for muscle tone, it's great for development of the muscle itself, but it doesn't necessarily do anything for that fat that's just so stubborn to get rid of on the
So the inner thighs, you said women love when they stand and they've got an area where their legs aren't touching.
Exactly. I mean, you think about the summertime.
Did they say that? They come in and...
Absolutely. So you think about the women who during the summertime it gets very hot, the inner thighs rub. We're getting great results from the CoolSculpting device.
How does it compare with liposuction as far as inner thighs?
Well, it doesn't. I mean, CoolSculpting is better. There's no downtime. The patients can get the treatments right away. Over the course of weeks to months, the patients can get that ideal result that they're looking for. So let me talk about the saddlebags area for a minute. This is an area that really bothers some of our patients and women. They work out, they're running, they just can't seem to get rid of it. Some women will actually say that they inherited their mom's saddlebags, and no matter how much they run, diet, and exercise, they just cannot get rid of that area. Well, with CoolSculpting, you can.
Is that right? So that little area, couple inches on the side of the hips,
gone. Over the course of weeks
Those
to
fat
months,
cells are dead.
It's permanently destroyed. So we really talk about true body contouring.
So the legs, you can go all around the legs, front of the legs, back of the legs, inner thighs. How are you doing the legs?
Well, the legs.
It's all around the legs?
It's actually the outer part of the legs, which we use a special applicator for that, and the inner part of the legs to create that thigh gap.
And we literally on short on time, about a minute left. But what areas haven't we talked about that you're doing CoolSculpting on?
The banana roll. And we think about
What's
that.
the banana roll?
The banana roll, Randy, is that little fold right underneath the buttock that women complain
At the bottom of the buttocks.
The very bottom of the buttock.
Okay.
We could get rid of that. We have a
don't
solution
you want
for that
that?
now. Well, it depends on who you're asking, right? But most women would rather not have that because then it actually brings out the true shape of the buttock more by having that fat pad gone.
So just that little area at the bottom of the buttocks that starts to droop with age.
Which starts to droop with age.
You get that and eliminate it.
Treat it with CoolSculpting.
Because I've talked to guys and they say liposuction, that's a tricky area. They don't like to do that area. So CoolSculpting is one of those.
Yeah, no downtime. You could apply an applicator there, non-invasive, go back to work, go back to life the same day.
Now you believe that you get better results because you are also talking to your patients as a gynecologist about nutrition and optimizing hormones, and you also combine it with a tightening procedure. Tell me about that.
So I think combination therapy for many of the things we do is always the best. I mean, it's not always one and done in just one. Even though the individual treatments themselves are fantastic, it's even better when you combine them. In my practice, we do bioidentical hormone replacement and hormone optimization. We talk about a clean diet. We talk about exercise. And for skin tightening, we have different devices that actually tighten the skin using radio frequency.
Do you believe that if everybody knew how good CoolSculpting was, back to CoolSculpting and we're going to close out here, but do you think if they knew how good this was, that there's not even enough doctors to service the people that could benefit from CoolSculpting?
If people really understood how great this technology was, how safe it is, and listen, I've used it on my family. If they really understood how well this worked, I think there'd be more patients than there are providers that are available. I think we've really begun just to touch the surface on non-invasive body contouring, and CoolSculpting really represents the gold standard. It really is, Randy. It's the gold standard in non-invasive body contouring.
So if you have unwanted fat on your body, you got to look into this.
You have to. It's a must-have.
And because you do liposuction too, you could at least give an evaluation to say you'd be better for CoolSculpting. And do you ever do that?
And we do. And that's what's so great about our centers. We do the full gamut. We offer laser liposuction. We offer nutrition support. We offer diet and exercise. And it really goes back to what I was saying before, Randy. It's a multi-modality approach for the results that we're getting.
Okay, good. I want to thank you so much for coming on the show. Very interesting.
Well, thank you, Randy.
Good stuff. And we're going to have you come back and talk more about what you're doing with optimizing hormones and things like that for women.
Absolutely.
And the robotic surgery. Can't forget that.
Forget the robotic surgery.
All right. Thanks again.
Yeah.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.